This is Dr. Corey Maas on Looking Your Best. I wanted to talk a little bit today, I had some questions today that prompted this, about rhinoplasty and some of the pre- and post-operative considerations that are important, and in general, surgery are quite important. One of them is about smoking. Smoking with rhinoplasty or facelifts or any surgery, frankly, reduces the oxygen carrying capacity in your bloodstream, and as a result, that important healing molecule isn't getting to the cells that it needs to repair the tissues that have been injured in surgery. So when we talk about smoking, I really encourage patients to stop well in advance of the surgery. If they can't stop well in advance, and we'll help them, there are great programs, medications, even the patch, which I don't mind nicotine if there's a tobacco or nicotine addiction. I'm okay with patches. It causes a little constriction of the blood vessels, but doesn't interfere with wound healing like smoking does, where the carbon monoxide and other pollutants that are in smoke bind to hemoglobin irreversibly. That's the oxygen-carrying molecule in our red blood cells, and really starves the wound of the needed oxygen it needs to heal. So I'll tell people to stop at least a week in advance. We'd like to get people stopped a month or so. It's very difficult for long-term smokers. There are, like I said, good medications in combination with the patch and therapy. For most patients, if they get a lollipop or some other thing that they can handle with their mouth, it's a good thing as an alternative to putting a cigarette in. And for many, many patients, I've got them to quit smoking for the long term, but smoking around the time of surgery is critically important. What's interesting is there's another molecule that is often described as being a complete no-go as it relates to surgery in general, and that's a drug called Accutane. And Accutane has been used for many years. It's an excellent drug, although it's gotten a bad name. It's been used for many years for acne treatment, and it's really the sort of top of the treatment pyramid. When all things fail, Accutane is the place to go for recalcitrant cystic acne. And historically, we have been taught that one shouldn't do any surgery at all while people are on Accutane. Now, in my experience, and we've got several rhinoplasties we've done now, people who are either just going off Accutane or taking low-dose Accutane, when making small incisions like those done in rhinoplasty and not lifting extensive flaps or doing any skin resurfacing, then the Accutane doesn't seem to interfere with wound healing. Now, I know this is contrary to popular belief. There are even a couple of case reports out in the literature about Accutane, but I would say that Accutane itself is really a major contraindication in my hands only in areas where we're doing laser skin resurfacing, where there's a large area surface of the skin that has been injured or even small, and that relies on those adnexal glands, the sweat and oil glands, and the epithelia or skin cells that line them to repopulate the skin surface. In those cases, there's a clear difference with Accutane. So I would say that Accutane is a relative contraindication in rhinoplasty, not an absolute one. We've had good experience in treating people who really can't or stop their Accutane suddenly, but have been on Accutane and have seen no untoward results as it relates to wound healing. And the last category is not really a medication or a drug, but is one that we should always think about, and that's people who have diabetes. And many diabetics are told they should never have elective surgery. I've had a number of people come with diabetes, and that's really not the case. It's certainly true that diabetics will have microvascular small blood vessel disease, but it doesn't mean they can't have surgery. There are certain precautions that we take. We certainly want to control blood sugars around the time of surgery, and post-operatively in the post-care scenario, we want to closely monitor and control sugars. But that by no means disqualifies them from having procedures that can help them look better. And that's really what we're here for, is to help people look their best. If you have any other questions about drugs or molecules or preconditions that might stop you from having rhinoplasty, facelift, or any of the other aesthetic procedures that we discussed extensively, please do not hesitate to write. You can send photos or short video clips to drmaas.com, and we're very happy to get those answered for you either privately, or we can share the questions with others so that they can learn. This is Dr. Corey Maas on Looking Your Best.